We have been up at this table day after day, highlighting the public health crisis that we face. We know that this is historic. Our country hasn't dealt with a pandemic of this magnitude in over 100 years. We have also tried to shine a light on the economic health of our state, and we've also tried to shine a light on the human cost of the historic rise in unemployment. Today, I want to focus on an aspect of this crisis that has too often gone unaddressed. There are severe mental health challenges going on as a result of this virus. There is fear, there is pain, and there is anxiety in this country and in our state, and those cannot be overstated. Some of that is legitimate fear of this virus. Some of it is anger at the place we find ourselves in. Some of it is restlessness and anxiety that is natural when we remove in-person gatherings, sports, movies, togetherness. There is a reason that our community includes so many activities that became non-essential when lives are on the line. But we cannot ignore the cost of abandoning them. This country is on edge. We have to recognize that, and we must be prepared to deal with it. We cannot pretend that everyone is doing just okay. We need to face that depression, anxiety, and fear that are plaguing us. First, from me to anyone listening who needs to hear this, do not give up. Do not give up on life. Even if you do not feel it today, you are valued. You are loved. You are needed. This state needs you to get up every day and be yourself. We need you to bring your unique light to this world. We are a better place because of you. I'd encourage everyone to reach out to people that may be experiencing isolation and loneliness. Those are powerful diseases of the mind. They are, too often, deadly. Please, to my fellow Mississippians, show some extra love today. Show some extra kindness. And please be willing to show empathy to anyone you encounter, and make an effort to reach out to those who may need you. I asked a few of our leaders who are doing important work in this arena to join us today. First, I'm going to turn it over to Wendy Bailey, who is our Chief of Staff at the Mississippi Department of Mental Health, to go over some of the resources that are available to anyone who is struggling emotionally or mentally in this crazy, and sometimes painful time. Wendy?
Thank you, Governor Reeves, and thank you for having us here today to talk about and share information on how to stay mentally healthy during this pandemic and how to access resources if needed. We appreciate you highlighting mental health at several of the previous briefings as well, and encouraging people to make sure that they take care of both their physical health and their mental health. We know that 1 in 5 Mississippians will experience a mental illness during their lifetime. And we know that 1 in 25 Mississippians will experience a serious mental illness during their lifetime, like bipolar or schizophrenia. Knowing these numbers, mental illness is common. It's common, but it's not often talked about. People across the world right now are experiencing fear, anxiety, depression, hopelessness, sadness, anger, all due to things that are revolve around this COVID-19 pandemic. But it's important for us to remember that everyone responds to stress differently. There is no right or wrong way to respond to stress. Everyone responds to it differently, and we have to make our mental health a priority. Stress during an outbreak like this can include fear or worry about your health, fear or worry about the health of your loved ones, anxiety from loss of employment. It can be changes in your eating or sleeping habits. Maybe you're sleeping too much or you're not getting enough sleep. Maybe you're eating too much or you're not eating enough. Sometimes we can see this also in increased use in alcohol and substances. And also, we can sometimes see an overwhelming fear of hopelessness or helplessness. But there are ways that you can cope. For example, sometimes we may need to step back from social media and all of the stories about the pandemic and give ourselves a break, taking care of our body and connecting with your faith, also trying to eat healthy, well-balanced meals and exercising regularly, and connecting with others. Governor Reeves spoke about social distancing. It has saved numerous lives, but at the same time, social distancing does not mean disconnecting with everyone. Making sure that you stay connected with your loved ones and you talk about your concerns and how you're feeling. But if your feelings start to impact your ability to function each day, we want you to know that you are not alone and that help is available and that there are resources. You know, when you have a health condition such as a cold or a broken bone, we don't hesitate to reach out to our primary care physician. But when you need to reach out to someone for your mental health, sometimes it's not quite as easy. And that may be also because you don't know where to go. You know, Mississippians are known for taking care of their neighbors and for being the hospitality state, which is absolutely wonderful. It's why I love to live here. But at the same time, sometimes we always want to make sure that everyone around us is okay, and we forget about taking care of ourselves. Self-care is not selfishness. Self-care allows you to take care of others. So it's important to give yourself some credit and celebrate the small wins. Check in on yourself. Make sure you're doing what you need to do to stay mentally healthy. Eating right, exercising, taking the medication that you need to take, and also making sure that you communicate and talk to those around you. There are a lot of resources that are available in our state. It's important that we don't ignore our own emotions and our ability to cope with this during this time, and that we reach out to those resources when they're needed. Back in March, the state of Mississippi, the Department of Mental Health, launched a website called mentalhealthms.com. And this is a comprehensive website to serve as a hub of information. We know that a lot of times the reason people don't get help is because they don't know how to find that help. So you can go to mentalhealthms.com, you can click on Find Services, and it's going to pull up a map of the state of Mississippi. You can select your county, and it will pull up mental health providers in your local area for both adults and children and youth. Another great thing about this resource is it has personal stories. Sometimes we want to hear from somebody who's been experiencing what we're experiencing, to where we know it's okay to talk about it. So you can go to this website and you can hear personal stories of people in Mississippi who have a mental illness and who want you to understand that recovery is possible and help is available. We also have a website called standupms.org. This site was developed in response to the opioid crisis, but it has a treatment locator to find providers in your area that provide substance use treatment. We know in any time in a pandemic or economic situation, we do see increases in substance use, and we want people to know how to access that treatment. We also have mobile crisis response teams in our state. Mississippi has mobile crisis response teams available in all 82 counties, and that service is provided by your local community mental health center. So you can go to that website, mentalhealthms.com, and you can find your mobile crisis response team. They are available 24 hours a day, 7 days a week, and they come to you wherever you are experiencing that crisis. The Department of Mental Health also has a helpline that's available on that same website. It's 1-877-210-8513. That website and that telephone number, that helpline, is available 24 hours a day, 7 days a week to connect you with resources in your area. There's also a national distress line that's through the Substance Abuse and Mental Health Services Administration, and it's called the National Disaster Distress Line. They have trained crisis counselors available 24 hours a day, 7 days a week, that are specifically dealing with responses to COVID. Also during this time, we know that we are seeing an increase in the number of calls to the National Suicide Prevention Lifeline. If you look at the calls in February to the calls in April, we've seen about a 20% increase in Mississippi calls to the National Suicide Prevention Lifeline. So we want to make sure that everyone knows that that resource is available. It is 1-800-273-TALK. 24 hours a day, 7 days a week. You call that number, you will be connected with someone in your state, in Mississippi, to talk to you if you are having thoughts of suicide. You know, it all starts with empathy, as you mentioned, caring, listening, and support, and realizing that during a time like this, we need to support our neighbors, and we need to make sure that we take care of ourselves as well.
Thank you, Wendy. That's again, mentalhealthms.com. Please feel free to go online and make a phone call should you need to do so to either one of those lines that Wendy had given us. I think we also need to recognize that government alone cannot solve these problems. And in some instances, even mankind cannot solve all of these problems. They are a consequence of our imperfect world. And the best way I know to deal with them is with faith. Of course, not everyone shares that faith, and this is certainly not to isolate those people. But I wanted to ask a friend of mine and a faith leader who has been instrumental in providing help to the community during this time to share some words of encouragement and hope with everyone this afternoon. That friend is Pastor Cameron Tate with Bridging the Gap Outreach Ministries here in Jackson. Pastor?
Thank you, Governor. What a privilege it is to be with you this afternoon. I want to remind us of a few things as I have personally been processing what this time has meant. Our state has been hit, and the world has been hit with some very unforeseen circumstances. And I'm reminded as I go back to Scripture, in Psalms 34:18, it's recorded, "The Lord is close to the brokenhearted, and he rescues those whose spirits are crushed." I'm reminded there are seasons in life where things come upon us that is a result, like the governor said, of a fallen world. But there is hope, and there is hope in a person, and his name is Jesus. And so I want to encourage all of you out there today to turn to the Lord in a moment like this. Please turn to the Lord in prayer. Please turn to your word. And please begin to reach out to your pastors or other locals in your area who are concerned and who love to call on the name of the Lord. I believe in moments like this in 2 Chronicles 7:14, when God reminds us that if we call out to him, then he would hear our prayers and he would heal this nation. And that is my prayer, is that you would find hope in the promise that God has a plan. And so I want to remind you to be in the word. Some churches have begun to reopen. A lot of churches are doing things virtually through Zoom and other means of media. Please begin to use that as a resource to you, whether it be via Facebook or via Twitter or Instagram or however you connect. But please stay connected to the local body of Christ. I believe in a moment like this, we all need one another. I believe this is the time that the church must stand together and be of help and a resource to people. One of the things I am so blessed about living in Mississippi, and as I've had the privilege to travel all over the state and preach the good news of the gospel, is I've seen so many churches and pastors with hearts who are ready to help. And so just a few of them, we will go in downtown Jackson where my friends David and Amy Lancaster serve there. They are always willing and ready to help the community. They've been down there for over a decade now. And so I encourage anyone with any sense of worry or concern or fear to go speak to my friends, Amy and David Lancaster. We will go. They distribute food to the community. They give hope, they give grace, and they give love. Also, there is the Gateway Rescue Mission, the Good Samaritan Center, and Salvation Army, which covers physical and spiritual needs. And so we want you to know that as a faith leader in this community, I am praying personally for you and your household and your family at this time. We know that it is not easy, but I want to remind you, there is a light at the end of the tunnel. I want to remind you that after every tragedy, there's always deliverance. So I'm standing with you. Stay encouraged, stay in faith, stay hopeful, and know that God will get us through this. God bless you.